One of the challenges for governments and policymakers globally is ensuring equitable access to health services. And this is quite crucial for achieving the universal health coverage, one of the Sustainable Development Goals. And this is particularly problematic for populations in rural, remote areas. One of the main obstacles to achieving access to equitable healthcare is the global shortage of health workforce. Health workforce that are skilled but also motivated are in short supply, especially in rural areas. Unfortunately, for remote rural locations, that's where we tend to have the highest disease burden, and the population also tend to be poorer. A study by the World Bank showed that only 25% of people attending hospitals in Nigeria get the correct diagnosis, and out of this, only 30% get correct treatment. There is a lot of waste of medicine because when the attending health worker is unsure, they tend to overprescribe. This is dangerous and expensive for the patients, but it is also contributing to the worldwide problem of drug resistance, especially antibiotic resistance. E-Likita is a simple, supportive, accessible platform that helps health workers that are located in remote rural areas to be able to approach patients in the correct way, ask the right questions, conduct the correct examination, and request the right tests so that they can arrive at the correct diagnosis. So what is called clinical decision support. It also links them up with a network of professionals globally who can also support them in areas where they're having difficulties. E-Likita has been developed and is being tested at Dechi Health Trust Fund Clinic, which is located in Gembu in Taraba State. Once this test has been done successfully, the aim is to actually deploy this software more widely across low-middle income countries in Nigeria, but also beyond. My research looks at how health systems work in settings where accountability systems are weak. So my research looks at how do you make health system work better in that kind of environment. And one way that you can do that is through a more bottom-up approach. A bottom-up approach is where you work with the community themselves as an asset and then look at what are the things that are already working for them and build from there upward to make it even more efficient than it is. An alternative way of strengthening health system is also the top-down approach. And in this case, E-Likita can be useful to the key gatekeepers of our primary healthcare system, like the chief executives of primary healthcare development agencies across the 36 states or the health financing authorities. If they adopt this kind of software, it is going to help speed up the process of quality diagnosis reaching populations. Our plan is to see E-Likita deployed across the primary healthcare landscape in Nigeria, where it will be improving access to quality health services for the teeming rural population. But we are looking beyond that. We believe E-Likita can be applied in many other settings across low-middle income countries, where it will be improving access to quality health services for our population and helping this move towards universal health coverage.